In this interview, I'm joined by Courtney Poja from Cornerstone, which is an organization that does work for survivors of trauma resulting from domestic violence, sexual violence, human trafficking, and general crime. So, through this conversation, we aim to shed light on the importance of creating safe communities and supporting survivors on their journey towards healing and resilience. So, thank you, Courtney, for joining me for this interview. And I just want to start by asking you to just give a brief overview of Cornerstone's mission and the range of services that it offers to individuals.
Sure. So we work with families and individuals impacted by domestic violence, sexual violence, human trafficking, and general crime. Our goal is to reduce the prevalence of violence in our communities, essentially. And we provide a full continuum of services, everything from emergency shelter to families and individuals who are in imminent danger. We provide legal advocacy, including orders of protection. We also do support groups and clinical therapy. We have a variety of housing. We do a lot of work in the housing space. And we also have school-based programs, so prevention programs with youth, as well as working with children who've grown up in homes who are impacted by violence. So really quite a broad and deep continuum. So
could you explain the specific approach that Cornerstone takes to help address these issues that people are facing?
Sure. I apologize. We work primarily from we really meet the victim survivors where they're at, and really trust that everyone is the expert in their own situation and how to keep themselves safe. So we work with folks on safety planning, and kind of what their next steps are. I would say overall our approach is really trauma informed, really acknowledging and working with people in a way that acknowledges that many of them have experienced some pretty profound trauma.
Yeah, I was on the website and I was able to look at the different areas that Cornerstone works in. And I also noticed that empowerment was definitely a deep value for the organization. And I'm wondering, how does Cornerstone enable survivors to regain control of their lives and also make positive strides toward securing a healthy future?
Sure. Yeah, so I would say definitely the way we do that is to never like tell anyone what to do, but to meet them where they're at, and then to figure out kind of what those solutions are and next steps, about how to not only stay safe, but how to kind of start building what that kind of the next steps look like. And a lot of that comes from helping folks find like affordable and safe housing, as well as addressing any trauma and mental health concerns as well. Also working with kids. So, just really kind of that very full holistic piece.
Yeah, and I think independence is definitely a really important part, I would assume, for survivors because gaining help initially is important, but then also getting back up on your own feet is also very empowering.
Absolutely.
And creating safe communities and reducing trauma-related incidents are definitely vital goals of the organization so far of what you've said. And I know that Cornerstone holds events to spread awareness about this, but how does Cornerstone exactly collaborate with communities to raise awareness and advocate for social change?
Sure. In terms of like the way, so we have specific communities in Hennepin County that we work with, that we either have like a formal kind of a contractual relationship with, but we serve pretty much all of Hennepin County. And so we do a great deal of outreach. Are you kind of asking about like how people learn about us or kind of what our community collaborations look like, or?
Yeah, basically that. So community collaborations. I also think I've heard that you do a charity or no, sorry, auctions, I think, to raise money. Is that true?
No,
Okay.
we haven't done that for quite a long time, but
Oh,
yeah,
yeah.
those are, I mean, they can raise a lot of money, but oh boy, are they a lot of work. So, um,
But I think there are definitely events where I think survivors come and tell their stories, correct?
yes, yeah. Yep. And so we always try to do that in a really thoughtful way too, just to, give people the opportunity to share their story if they want to, but then also really doing that in a way that's thoughtful and respectful of their kind of their own journey. But yeah, so we do fundraising events usually once a year. We're kind of back into it now post COVID. We obviously took a couple years off of that. And so we are, so we do those kinds of events, and those are primarily to generate revenue. But we also do quite a bit of events out in the community in terms of like we'll go speak places like Rotaries or businesses, different faith organizations, pretty much whoever invites us, we're able to come and share information about what kind of the work that we do, as well as how to access those services. So.
Yeah, yeah. And definitely, I think Cornerstone looks at a very sensitive issue and targets very sensitive issues. So it's definitely important to be respectful of survivors and their stories and really let them know that people are there for them, and they can choose that if they want to share their stories or if they don't. And I think that's really important as well.
Yeah, absolutely. Yeah.
Yeah. And I think you brought up how you also help children. I think that's the most sad part because there are children that are exposed to trauma and they most likely will have unique needs different from what adults need. So I'm wondering, how does Cornerstone tailor its efforts to address these needs of children and facilitate healing within families?
To work with kids a lot of times from the youngest age possible after they've been exposed to violence, and really just provide strong adult presence. And whether, I mean, it's not necessarily like a formal mentorship, but the like working with kids so that they can understand like it's okay to get angry, but here's the healthy way to do it. And so kind of just working through some of those feelings and really doing our best to try to mitigate the impact of trauma, because we know for kids who've been exposed to violence, whether they were victims themselves or it was in their home, are more likely to struggle academically, socially, in terms of mental and even physical health down the road. So we know it can definitely have a profound impact. So we do a lot of work in that prevention space to really just connect with kids from the time they're little on, and some kids we have relationships with throughout their whole lives. So.
Yeah, that's really nice. And I guess without getting into too much detail or I guess invading anyone else's privacy, could you share like a specific story or that really impacted you, I guess, as you've been working in this field for a while?
So I would say, like, because I don't do any direct client service, I work in fundraising. So I don't work directly with our participants on a daily basis. However, I do have opportunity to, when we have different client events and things like that, and volunteer events and things like that, then I'm able to kind of connect with the families, sort of more specifically. And I mean, yesterday, I would say, give an example. Yesterday, we did a school supply giveaway and an end of summer cookout. And so it was just really fun to be around kids. And, a lot of them, the families don't have the resources to, school supplies get so expensive, right? So to be able to have those donated and then be able to give them out to families and see kids get so excited about their new school supplies for the year and excited for the school year was really cool to see too. So.
I guess I would assume that being in this specific area is very rewarding, especially when you get to see the impact that you're making on people.
Yeah, and my role in particular has been really because I had to, kind of see the day-to-day work that's going on, even if I'm not carrying it out myself, but get to see my colleagues doing, a lot of the great work, but then also to see the large amount of community support we have, that people really do care so deeply about these issues and about our families and stuff. So that's a unique position that I get to be in, but again, yes, correct. It's really rewarding. So.
Mm-hmm. And I think one other important part of this area is active listening, definitely to people who need help without being judgmental. And it's definitely a pivotal aspect to this field. So when you are training your advocates to provide effective and empathetic support to survivors, I'm wondering how Cornerstone trains its advocates so they can be empathetic and be non-judgmental.
Yeah, and so I since I don't work directly with advocates, I can kind of speak to kind of our broader training that we have. I know everybody works one-on-one with their supervisors, but we do have all of our advocates are certified sexual assault advocates essentially. So they go through between a 40 to 50-hour training when they start. And then we ask all of our staff to do that too, just so they have that same, like education and kind of baseline for how we do our work. And so that's definitely one way that we really get people kind of all on the same page and in the way that we do our work. So.
Okay. And I don't want to take up too much of your time, so I'm just gonna ask.
You're good.
Yeah. I guess looking ahead, could you provide some insight into Cornerstone's upcoming plans or initiatives, and how does the organization envision its ongoing role in making a positive impact on survivors' lives?
Yeah, so this is a really interesting and kind of exciting time for the agency. We're getting a new executive director sometime this fall. So I feel like a bit of that answer is to be determined because we're going to be doing a brand new strategic plan under new leadership. So it will really, that will really kind of shape and reflect sort of where we're going and what we're thinking about. I would say if there was one substantive area we were really invested in, obviously in a lot of our work, but also that would really be the housing piece and continuing to invest resources in that, because we know without stable housing, it's really hard for people to stay out of violent relationships and to start over on their own and to even, hold down a job or, to be able to, address any of their physical or mental health concerns. So really just continuing to invest on the housing side.
Yeah, that's great. Well, okay, thank you so much for this discussion. I think it was very insightful, and I think I've gained profound insights into the impact that Cornerstone has on survivors' lives. And I think that the services and the focus of the organization overall on empowerment, advocacy, and community collaboration really just shows how much of a significant difference Cornerstone is making. And I hope that if people watch this interview, they get that out of it too. So thank
Oh,
you.
thanks.